Hello, and welcome to our presentation on the multidisciplinary approaches to heart disease prevention. Today, you're going to hear from three providers, a dentist, a cardiologist, and a dietitian, who are going to be talking about how dental providers can be engaged in heart disease prevention. Our first presenter is Dr. Marwa Gamam Forrest, a general practice dentist from Edina, Minnesota.
When framed correctly, preventative dentistry can have an impact much greater than just positive oral health, addressing risk factors like tobacco use and sugar-sweetened beverage consumption can lead to reduced risk for diabetes, heart disease, and other chronic conditions. By framing the counseling of risk factors beyond just an oral health lens, dental providers can make a much stronger case for the importance of behavioral changes. Within the dental clinic setting, there are various opportunities for providers to engage patients in health behavior change on both the environmental and personal level. In order for providers to be successful in behavioral counseling, it is critical that they are working in an environment that supports it, something that begins before the patient enters the clinic. Counseling is more than just instructing patients to stop smoking. It requires training, practice, and knowledge of available resources for referral and follow-up. Every few years, clinics should try to provide staff with counseling training, as those who have received training are more likely to perform it on a regular basis. In addition, providers should have an up-to-date list with referral resources and services to provide to patients. Being able to refer patients reduces the provider's counseling burden, especially when free cessation services are available like they are in Minnesota. Even trained and confident providers need reminders to provide adequate advice and counseling. One effective way is including questions about both tobacco use and sugar-sweetened beverage consumption in patients' health records, and updating them every visit. Seeing this information on the chart provides an effective reminder to start the conversation and allows for consistent follow-up.
Our research at the Minneapolis Heart Institute Foundation has also found that in addition to prompts in the EHR, it's important that providers utilize strategies such as the 5 A's as a way to engage patients in tobacco cessation and sugar-sweetened beverage reduction. It's important to ask patients if they use tobacco or drink sugar-sweetened beverages, followed by advising them to quit and/or reduce. That should also be followed with assessing their willingness to change, which determines the next step, which could be assisting them with appropriate treatment, medication, or counseling services, or utilizing the 5 R's of motivation, which are relevance, risk, rewards, roadblocks, and repetition. These are 5 simple strategies to help patients understand the importance of quitting tobacco and moving them through the stages of change. Lastly, it's important to arrange a follow-up by making a note either in the EHR or your paper records. This ensures that the next provider will appropriately address the behaviors. Next, we'll be hearing from Dr. Michael Miedema, a preventive cardiologist at the Minneapolis Heart Institute.
Hello, my name is Michael Miedema, and I'm a preventive cardiologist with the Minneapolis Heart Institute and a researcher with the Minneapolis Heart Institute Foundation. And my main area of interest is cardiovascular prevention. And I think that it's become quite clear over the past couple decades that we need lots of help in terms of cardiovascular prevention in terms of getting through to our patients. And that includes cardiologists, but also primary care providers and other healthcare providers such as dentists. And so I think there's a unique opportunity for individuals in the dentistry industry to connect with patients, especially younger patients. So frequently patients that are older and have risk factors are seen by their primary care providers and cardiologists fairly often, but younger individuals often don't see a doctor, and so their interaction with their dentist might be one of the few times they see a healthcare provider during that year. And so I do think it provides a unique opportunity. And there's been a big shift in cardiovascular prevention over the last couple of decades. Previously, it was mainly kind of a check a risk factor, and if it's a high level, then you should think about treating it. So people would get their cholesterol checked, and if the number's high, they would consider lowering it. we've really seen a big shift in the last couple of decades towards more using cardiovascular risk. And it's very clear that cardiovascular disease is a multifactorial process. And so there's lots of different risk factors that factor in to who develops a heart attack or who develops a stroke and who doesn't. And so paying attention to multiple different risk factors is very important. And so it's not just your cholesterol that causes plaque to build up in your arteries, but it's your cholesterol plus your blood pressure, plus your blood sugar, plus diabetes and smoking and what you eat and how active you are and your genetics and on and on. There's lots of different risk factors we have to pay attention to. And so it's important for patients to understand that to get an idea about their risk for cardiovascular disease, they need to look at the total picture. So if you're a 65-year-old male smoker with diabetes, but you have normal cholesterol, that doesn't mean you're low risk at all. You're actually quite high risk. Whereas if you're young and have a little bit of high cholesterol, but no other risk factors, you're not necessarily high risk at all. And so it's important to understand cardiovascular risk when talking to patients about their overall level of risk. And when it comes to treating cardiovascular disease, it turns out that treating it is important on multiple different fronts as well. It's not just a good idea to lower your cholesterol, but it's a good idea to have lower blood pressure and lower blood sugar and to work on good nutrition and to be physically active. And if you're smoking, to quit smoking. Those are all very important. I think quite often we see patients that look at lifestyle stuff and medications as kind of substitutes for each other. So instead of taking a cholesterol pill, they think, well, maybe I'll just eat a little healthier. Or instead of eating healthy, they'll say, I'll just take the cholesterol pill. And it's very clear it doesn't work that way. You want to attack on multiple fronts, and the lifestyle things often kind of intervene at multiple levels. So a healthy diet not only lowers your cholesterol, but it also can improve your blood pressure, and it improves your blood sugar. It can improve multiple different things, and the same thing for physical activity. All of these different interventions can affect multiple different pathways, and they're all very important. Finally, just a word on smoking cessation. In terms of younger people, this is probably the most important preventable cardiovascular risk factor. And if you look at cardiovascular risk and if you look at potency of risk factors, smoking at an early age and then onward into middle age is one of the most potent risk factors there is for cardiovascular disease. And again, given that young people aren't seeing physicians as often, this might be an opportunity for the dentistry industry to really intervene and have a positive impact on cardiovascular health. Getting an individual to quit smoking is very difficult. They've looked at multiple different interventions, and none of them have worked that well, frankly. But what we do see is that the more interventions that are attempted, the higher likelihood of success. So the more people that tell that individual that smoking is unhealthy for them, the more likely they are to quit at some point down the road.
Lastly, we will hear from Gretchen Benson, a dietitian and manager of healthcare systems integration at the Minneapolis Heart Institute Foundation.
Hi, my name is Gretchen Benson. I'm a registered dietitian nutritionist with the Minneapolis Heart Institute Foundation. And today I'd like to offer some tips and strategies that you might find helpful in coaching your patients. As Dr. Miedema mentioned, individuals often see their dentist more frequently than other healthcare providers, so it really provides an ideal opportunity for preventive care and behavioral counseling. In terms of the big picture, we look to see that overall individuals are following a healthful meal pattern and eating regular meals throughout the day. We like to focus on a whole foods approach. So whole foods are things like fruits, vegetables, and whole grains. These foods contain more nutrients and vitamins than their processed counterparts. So processed foods frequently contain large amounts of salt or sugar to extend their shelf life, and it also helps to make their flavor more appealing. But whenever possible, it's best to encourage your patients to eat foods without an ingredient list, foods like salmon, broccoli, or a piece of fruit. One of the most basic ways to encourage healthful eating is to really follow the My Plate strategy. What this means is essentially encouraging your patients to fill half of their plates with fruits and vegetables, and really aiming for a mix at different meals of a variety of colors of fruits and vegetables, because different colors represent different nutrients, and getting a mix is ideal for overall health. The other quarter of the plate should be filled with whole grains. So whole grain foods are things like whole wheat pasta, 100% whole grain bread, quinoa, oats, brown rice. All of those are good sources of whole grains. And then the remaining quarter of the plate should be filled with a source of protein. So things like fish, chicken, beans, nuts, all of those are healthy and versatile sources of protein. To balance this out, oils should be used in moderation. We really want to focus on aiming for some of those healthy plant oils. So oils like olive, canola, soy, corn oil are all good options. And then to balance out the meal, really encouraging drinking water, coffee, or unsweetened tea with the meal. Reducing added sugars is something we also want to focus on in terms of improving both oral and cardiovascular health. We know that high sugar intake can double heart disease risk and also increases the risk for oral health problems. So one of the ways that we want to limit added sugars is really limiting foods that have added sugars in processing or preparation. We know that they provide calories to food, but they don't really provide any nutritional value. And I think it's important to understand that natural sugars are found in some healthy foods like fruits, vegetables, whole grains, and milk. And these foods do not negatively impact our health like sugars that are added to foods and beverages. Unfortunately, at this point, there is no distinction on our current food label. So the only way to really identify whether a food has added sugars is to look at the ingredient list. And some of the names for added sugars include sucrose, glucose, or high fructose corn syrup. So really limiting foods when sugar is one of the top 3 ingredients is really the best strategy to avoid added sugars. In terms of practical strategies to help your patients reduce added sugars, can be helpful, first of all, to really promote drinking water most often. In terms of fruit juice, you really want to aim for just a half a cup of fruit juice per day. It is a very concentrated source of sugar, so only 1/2 cup serving can really count towards your fruits and vegetables throughout the day. The rest of the fruits and vegetables that you eat should come from whole sources.
Thank you for viewing our presentation. For additional resources, please go to www.heartsbeatback.org/oral